I'm going to read a little bit of this kind of found poem, Ulipo, object poem, I don't know what it is, a bit of everything, and it's from lines of a medication leaflet, all alphabetized into a receipt. But I won't read it all because we'll be here forever. A. Able to advise you if you are not sure. Acquired hypothyroidism in children. A day of the dose will then be increased, adjusted by your doctor when you adjust it depending on response to. Adolescence develops severe. Adrenal glands, your doctor will be adrenal insufficiency as you may. A drink of water in the morning at least. Adults and children if you are giving. Adults over 50-year-old or patients, adults up to 50-year-old. Age, weight and the condition being a liquid formation. Always take this medicine exactly as your... Okay, forgive me because I can't pronounce the really long medication names, so just pretend that I can. Amiodarone or propranolol. Amount of acid produced by the an allergic reaction, swelling of the an autoimmune disease or following an anxiety disorders and contents of the pack, and must not stop taking it or change. And oral contraceptives, the pill and prednisolone used to treat androgen containing medicines for, and the container with you to the angina thickening and hardening of an hour before the first meal of the day. Antacids used to treat indigestion, anticoagulants used to prevent blood, anticonvulsants used to treat, anti-inflammatory medicines such as any medicines via wastewater or any of the tablets, contact your nearest, are allergic to levothyroxine or any of are 50 years of age, are taking, have recently taken, or artery walls and arteriosclerosis, attention or hospitalization. B. Barbiturates such as phenobarbital. Beat, rapid breathing, fever, fits, and because it has been attacked by their being born with a thyroid gland that before breakfast, before taking levothyroxine, benign intracranial hypertension. Beta blockers such as atenolol and buying such products. By any of the adverse events such as by reporting side effects, you can help. Calcium salt supplements. Carry out a blood test to work out how. Carton, the expiry date refers to the last. Caused by the early closure of joints in. Cause side effects, although not cellulose, sodium citrate, acacia, and changes in light, shallow breathing, cholesterol. Chronic hepatitis C virus. Cimetidine and sucralfate used to clot. The dose may need to be. Colsevelam used to lower. Cholestyramine and cholesterol used to. Combination and iron supplements. Common symptoms of hypothyroidism, confusion, fits and coma. Congenital hypothyroidism in infants. Contains important information for you. Contents of the pack and other. Contents of the pack and other. Coronary artery disease, high blood pressure, corticosteroids such as hydrocortisone. Crisis, and you should contact your D. Day of that month, do not throw away. Day the dose will then be increased by. Deficiencies corrected usually at a deformity of the skull in infants. Department at your nearest hospital. Diabetes or warfarin to prevent blood. Dicumarol or phenindione. Difficult breathing, skin rash, or dilated pupils, fast or irregular heart. Doctor first. Doctor has told you to check with your doctor immediately and overdoses. Doctor immediately if you have any of doctor or pharmacist if you are not sure. Doctor or pharmacist or nurse. This doctor or pharmacist or nurse this does not produce enough thyroxine. Do not store above 25 degrees centigrade. Store in. Do not stop taking your medicine. Do not take levothyroxine if you do not use this medicine after the dopamine, terbutaline, salmeterol. Dosage of 100 to 200 micrograms daily. Dosed by 25 micrograms every 4 weeks. Dolcilpin. Driving and using machinery. Due to changes in bone growth. E. Effects to look out for. See section 4. Effect you may need urgent medical. Epilepsy such as phenytoin. Everybody gets them. Expiry date which is stated on the... I'll leave it there.